Hi all, I'm Giz Gulnerman. Our submission number is 2684. Our paper title is Assessing Human Wellbeing in a Trustworthy AI World, the Complexity of Urban Data. I work for Ankara Hacı Bayram Veli University as an assistant professor, and my expertise is in geospatial data science. My research focuses on extracting information from crowdsourced datasets, especially through social media data. I have a background in urban planning and geomatics engineering, and I'm keen on developing an international fund to carry out geospatial database projects with a focus on sustaining well-being. Today, I'm going to discuss how AI should handle complex urban data while assessing environmental impact on human well-being. We exchange our thoughts on this topic with Professor Florian Koch during Erasmus Mobility Program when I visited HTW Berlin last year for a short period of time. Let me introduce my content at first. Firstly, I will start with the concept of well-being. Then I will mention about urban well-being and measuring urban well-being. And after that, I will introduce indicators of well-being, and I will try to figure out how to formulate complex urban data for well-being. And then at the end, I will raise two questions to conclude our study. First, let's start with well-being. And well-being is more importantly within the Sustainable Development Goals of UN. The urban impact of human well-being is a current and critical issue. Well-being is directly associated with the third goal of the United Nations Sustainable Development Goals, though other SDGs include indicators corresponding to human well-being. It's important to note that while human well-being in general is associated with several factors such as economic, social, and gender considerations, urban well-being is much more related with urban design, land use planning, and environmental aspects, and refers mainly to the SDG 11. Nevertheless, these terms are interconnected and mutually, of course, influence each other. Urban well-being commonly assessed by several indicators, including green environment, active transport, diversity, density, and climate. But we know every person experiences these differently. Human perception is considered for a granular look at the interaction between urban environments and individuals. Some people spend most of the time around their neighborhood, while some others use the other spaces of the urban area than their living spaces. Therefore, we cannot directly target the human settlement spaces for their well-being, especially if they are living in the heterogenic big cities such as Istanbul, Rome, London, and Chicago. And I would like to show 3 cities images, and I would like to mention about how we concentrate on well-being, urban well-being, and how we see and discuss on that. When we look at this image, this is an image from the central area of Rome, and we see crowd in there. We see tourists walking around and standing around and have the city around them. So they have experiencing city as tourists, but also there are buildings and settlements in there. So people have different views in the same area, and they're impacted by the urban environment differently. So When we look at another example from Istanbul, we see the huge sea in the city, near the city. This is the Marmara Sea. And we see people sitting around near the city and near the sea and look at the sea, having coffee with friends and family members. But mostly most probably they are from the other regions of the city, not particularly in that from that area. And so they have good views around them, and so they have chill out in that moment, most probably. But when we look at a bit far, we see settlements in there near sea, but also they're very near to the sea, but most probably they're perceiving this area as the crowded area, and they most probably have the traffic jam every day, and most probably they're not going out in the weekend times because they are too crowded by the other visitors. So again, we have seen the different perspectives in that area. So we have another city in here, Chicago. We have another view from there, from the riverside walk. And if you are tourists or just visitors, you may just go through the walkways and see around and have calm feelings with you. But if you are working in these buildings, maybe you have affected the whole year cold weather, and you might feel the dangerous, you may feel, and maybe you can define the area as a dangerous area because you heard many gunshot attacks in these areas, and most probably you are not visiting this riverside walkways every day, just maybe 1 or 2 times in a year. So you have different perspectives than the other peoples as well in that area. So this is just a small, just an early outcome maybe, but recent studies indicate a growing use of new forms of urban data because of these differences. And so they're including wearables, smartphones, and urban sensors in well-being research alongside traditional techniques. These studies progressively aim to understand the interaction between urban environments and human mental states. Although there are several marvelous attempts to retrieve such data and conducting such studies over various urban spaces, most of these attempts remain limited because the most faced problems in the quantifying urban well-being studies based on technical inadequacy for collecting or accessing spatial data. And another problem is the limited and oriented participation. And the other problem is the privacy issues in collecting and processing such data with AI techniques. These problems limit studies' spatial boundaries, time boundaries, and cause spatial, temporal, and participation biases. Studies solely based on urban-based maps ignores changing environments in human surroundings and also human or activity spaces in urban areas. These problems might be seen as the modifiable areal unit problem, commonly argued in spatial data science, but we can ask, what is the boundary of impact area of a human mental health? How should it be predetermined? So, however, we also would like to emphasize that this is more than a 2D or 3D modifiable areal unit problem and indicates mostly multidimensional perspective problem. Then we look at the indicators of urban well-being, and outcomes of a study has already proved the SDGs indicators on well-being do not directly correlate with the subjective well-being of individuals, but mostly correlated with the Human Development Index, Economic Freedom Index, and Global Competitiveness Index. In addition to that, if you look at the lists in here, it's barely said that urban well-being is handled within the indicators list of the UN SDG 11 or in the other SDGs as well. So we think about how to formulate this complex urban data as the indicators of urban well-being. In this context, we formulate the question of how this complex urban data requiring problem can be solved and how current data services and technologies support its feature. We illustrated the required data framework in this figure and engage current technologies to assist in monitoring human-urban interaction for modeling trustworthy AI systems in the development of high human perception-based urban environments. Current technologies provide us base maps, street view imagery, urban sensors, and individual sensors. In this respect, AI will try to legitimize a way of revealing the impact of urban environment to human well-being, which means also human mental state. Trustworthy AI draw the 5 important perspectives for the set words: fair, transparent, private, robust, and explainable, which means AI projects should regard different demographics over the complex urban data, presents methodologies, data, and decision-making process, openly protect all personal information against unauthorized access, and should all able to function correctly under diverse conditions, such as must handle incomplete or noisy data, even in that condition should provide reliable outcomes. And lastly, decisions and processes of AI should be easily understood by humans and understand the AI actions by reducing the fear of black box decision making. In this study, we discussed and had to identify the complexity of urban data in the current developments for urban well-being studies. And based on multi-sourced urban data for the development of AI models for monitoring urban well-being, we discussed if these models have already changed human urban activity spaces. So we raised 2 questions about that. Do urban well-being AI models lead to different behavior patterns concerning the use of the urban spaces? Is our first question. And the other question is it really possible to increase one's individual well-being through AI models? If so, should we? Or are we going to base urban policymaking on such outcomes? Because we expect in the future a growing amount of self-data sources and contributions from the autonomous vehicles, which leads to the creation of different vision-based focal points. This might enhance fair and robust models, but also lead to less transparency and an increase in privacy issues. So here is the references that helps to increase, that helps to contribute to our tools and develop it. And I'm thanking you all for listening. I'm developing ideas on how we can measure urban impacts on human well-being from a more granular perspective. And currently I'm revising a postdoctoral project proposal that I wrote last year and applied to Marie Curie postdoctoral fellowship program. So please feel free to reach me out if you want to discuss this topic with me. Thanks again. Bye.